My next guest, one of more than 1,000 current and former HHS employees who signed this letter demanding that Secretary Kennedy resign or be fired. Anna Culbertson is a former scientific program specialist at the National Institute of Allergy and Infectious Diseases. She's also an organizer with the group Save HHS. Anna, let's start with the Senate hearing. What does today's testimony tell you about the direction of our public health?
Yeah, I think that Secretary Kennedy just is unable to really make decisions and kind of like influence policy with a scientific backing or medical expertise. I mean, he really is focused on a particular agenda and just is not taking into account the things that people who are really familiar with these topics have to say.
So before you called for his resignation, your group listed its concerns in a letter to Secretary Kennedy just last month. Can you sort of lay out what was in that letter?
Yeah, the main points that are really important is just that Secretary Kennedy has continued to spread misinformation. And because of this misinformation, he has put the federal workforce in a really precarious and vulnerable situation. We see this with the shooting that occurred at the CDC. And he's really just putting the future of the American health in danger. I mean, we're going to see people dying from the policy changes and the misinformation that Secretary Kennedy is choosing to continue to enact.
Now, I know this is personal for you because you are a rare disease patient. If you're comfortable telling us, please do. And just tell us the kind of challenges you could face because of restricted access to vaccines.
Yeah, so I have a medical condition that impacts my ability to, I have a very mild case, but I have my ability to understand kind of oxygen. It impacts my breathing. It's kind of complicated. But basically, if I don't have access to vaccines, when I get these like really common and kind of very simple like things like a cold or like strep, I can't take certain medications. I can't take certain like cough syrup and things like that. It also puts my condition at risk potentially for escalation, and it's just really, really intense for me. And so, if I don't have access to vaccines or the communities that I participate in don't have access to vaccines, if herd immunity is really challenged, I'm facing like very serious life-threatening consequences. And so it's not just that I mean, I do care about the health of the American public, but I also care about myself and the people who are like me, who are very vulnerable to these changes in vaccine policies.
Right. And I mean, you're right in there in the scientific world as a specialist. I mean, you know this stuff so well, both personally and professionally. And now Secretary Kennedy is really, bashing the CDC over its handling of the COVID pandemic back in 2020. But we should continue to point out that President Trump was the one in office at that time, the same time that Kennedy is bashing. So how do we get through this and regain trust in the healthcare system?
I think something that is really important to think about is that, these agencies that Secretary Kennedy is overseeing, there is always going to be room for improvement. I think that when it comes to the COVID crisis and just communication with the general public and being mindful of the general public's interests and concerns when it comes to things like vaccines, preservatives, those are all just extremely important things that we keep in mind. It's important that we're listening to our communities. We're giving them the tools to understand why different decisions are made, why different vaccines are recommended. I think that just strengthening the bridge between the public and between healthcare professionals and scientific experts is just extremely important. And being an empathetic ear, because I think the concerns that the general public have about vaccines and things like preservatives are really important to listen to and kind of work through with medical professionals.
Anna Culbertson, great to have your insight today. Appreciate you. Thank you.